Phoebe Cardiologist Dr. Rachel Harris and I are together today to talk about heart health, particularly heart health in women, and we're also going to share a healthy recipe. Now this is for Italian caprese avocado toast.
Yes.
Sounds fancy, really not that fancy. Why did you choose this recipe?
Well, I chose this recipe just in celebration of Heart Month, and a lot of my patients will come in who have heart disease, and when we start discussing ways that you can change your diet, particularly with breakfast, and I say eliminate things that are high in saturated fats, a lot of times the question comes up, well, what can I eat? You know, a lot of times it sounds like we're just taking a lot of things away when you have heart disease, and our goal today is to add back. What can you have that actually tastes pretty good and has the good fats that you need, and that you can make in probably under 10 minutes.
So the ingredients for this recipe, we've got avocados, cherry tomatoes, basil, low-fat mozzarella cheese, some pepper, balsamic vinegar, and whole wheat toast. So, Dr. Harris, I'll let you start mixing the basil and pepper in with the avocado, and then we'll put that on some toast. Now, why are, you mentioned typical breakfast food, bacon, sausage, really sugary cereals. Why are those things not a great way to start our day?
Well, really, you know, a lot of times I make the analogy of when we're born. You will eat pretty much anything that doesn't have a lot of these things in it, right? So fat, sugar, salty things, we are not born to eat these things. It's not until they're introduced, which is why I tell my patients it's learned behavior, that we pick up these habits. And so a lot of times you can actually retrain yourself to eat a lot healthier. So you don't have to, and I know that might sound foreign to a lot of people, you do not have to have meat for breakfast. Right. There can be one meal that we exclude that from the diet. So this recipe particularly is good in avocado, which is rich in good fats. Again, this is unsaturated fatty acids. And so this gives you the richness that you're looking for, and gives you that sensation of fullness, but it's also healthy because avocado is rich in fiber as well. And so that's why we want to pair it along with whole wheat bread. That's going to give you the additional fiber and as well as some protein as well.
So we're just putting that avocado mixture on the toast, and then we'll put some mozzarella cheese and the tomatoes and a little balsamic vinegar, and then put it in the oven just for a minute, basically just to melt the cheese.
Right.
A poor diet puts you at greater risk of heart disease. What are some other risk factors that we should be aware of?
So again, you know, a lot of us can't, and again, this is low-fat cheese. If for someone who's looking for a healthier alternative, you can exclude the cheese altogether. But for some of us who just have a family history that's high in heart disease, you're going to not be able to alter that. So again, as much as we can do in terms of being able to eliminate the increased risk, we're gonna try to do. So we're gonna try to eat healthier. Other things that increase our risk are gonna be if we have diabetes, if we are overweight, if we have hypertension, if we have traditional risk factors such as smoking, or drug use, these are all things that are going to increase our risk for underlying heart disease as well.
So when we talk about heart disease, what all can that encompass?
Well, heart disease is anything that has to do with our vascular system. So when we say heart disease, it's all encompassing of strokes. It also encompasses the heart with our plumbing system, if you will, the blockages that can occur, but then patients can also have underlying hypertension or be predisposed to heart failure. So they can have congestive heart failure, they can have valvular heart disease as well. So there's a lot that sort of goes into underlying heart disease that we cover under the heart and vascular.
I'll let you put a little balsamic vinegar on there, and then we'll put it in the oven just for a minute, basically to melt the cheese.
Perfect.
So this is very flavorful, but very simple.
Yes, very simple, very easy to make, and very filling. Very good.
So, Dr. Harris, often people think of heart disease as primarily a disease of men, but that's not true, is it?
It's not. And like we talked about before, heart disease is the #1 killer in women. And all too often, women come in and they do not recognize what those symptoms are. And we can't stress enough, anything from the level of the neck on down to the belly button, if you're experiencing any symptoms that just don't feel right, that you want to make sure that you're presenting for care. And those symptoms can be chest pain, chest pressure, nausea, vomiting, or just this sense that they don't feel well and it's unexplained. We want to make sure that we are asking them to just see a provider, particularly a cardiologist, that can evaluate their symptoms.
Obviously, I got the toast out of the oven. It was just in there for about a minute or so. Can there be different symptoms in women than are typical in men for heart attack?
Yeah, when we think of men, we think of that crushing substernal chest discomfort that might occur, but in a lot of women, it may be more subtle. They may just have shortness of breath, or they may have back pain, or they might have nausea or fatigue, or again, shortness of breath. But for every woman, they identify when something's wrong, something that just doesn't feel right. And we really ask them to go on that hunch. We've done research to look at the average time that it takes a woman to come and present for care. And unfortunately, a woman will go through every type of home remedy before they will acknowledge that maybe this is my heart. And so that delays the time frame for their presentation for care.
So what is the best overall advice you have for women to stay healthy and to reduce their risk of heart disease?
I think in general, as women, we're caregivers for our family. And so the best gift that we can pass on is to continue taking care of our loved ones and understanding that what we make and what we prepare for our loved ones doesn't just influence us, but influences everyone in our household. And so for women to understand when they're at high risk and whether their family members may be at high risk, that's what I'd like for them to know. So knowing your numbers, knowing your statistics, everyone has their own personal statistics, but knowing when their family is at high risk, and if you know that you had heart disease in your family early on, present to your provider, ask those questions about being evaluated.
All right, you want to try some avocado toast?
Sure do.
It's delicious.